Southeast Regional ED, this is Ambulance 3 requesting a patch.
Ambulance 3, this is Southeast ED. Go ahead with your patch.
Hi Southeast, Ambulance 3, we're inbound with a 5-year-old female who was the unrestrained backseat passenger in a motor vehicle crash. Patient did have a positive loss of consciousness. She is now awake, complaining of neck and abdominal pain.
TeleEmergency, this is Catherine. How can we help?
Hi, Catherine. This is Clancy at Southeast Regional. I'm in room 5, and we have a PD trauma coming in. So we just got a patch from Ambulance 3. They'll be here in about 3 minutes with a PD trauma that had a loss of consciousness. They're now awake and alert, but complaining of neck and abdominal pain.
Okay, and what kind of support do you need from us today?
I think mostly just RN documentation to start, but doc support in the background would be great. We're probably going to end up needing to transfer this patient out.
And Clancy, I'm going to grab your site book so that we're on the same page about what kinds of medications you have, what equipment you have in your room if you need it, and what hospitals you transfer to if we need to.
Airways intact, breath sounds equal and clear bilateral. C-collar in place. Abdomen is rigid.
So at this point, we're viewing ourselves as having joined the bedside team, just like if they had an extra nurse and extra doc walk into the room. And that includes doing whatever we can to allow the local team to stay at the bedside taking care of the patient. So our nurses doing all of the high-level documentation for them, as well as taking advantage of this bird's eye view we have of everything in the room. And that can include subtle changes in vital signs, something different on the monitor, anything like that. And that's happening while I'm anticipating what the next step might be. So that could be IV access that they haven't gotten yet. Should we be thinking about the EZ-IO? Can I take a look at the chest x-ray before they have the opportunity? Thinking about, in this case, things like blood transfusion, need for transfer, and letting the transfer organization and transport know, arranging a helicopter, etc.
Dr. Susie, both of my IV attempts have blown.
All right, maybe we should look toward maybe an IO.
You know what? I haven't used that in a while.
Clancy, I just want to remind you that your EZ-IO is in the middle shelf of your cart, and I'd be happy to help you go through that.
So based on this being a pediatric trauma with vital signs that aren't so good and likely some significant injuries, in most cases she'll need to be transferred. So all the bedside care and resuscitation is continuing. In addition to continuing to help in whatever way I can, I'll be calling the accepting hospital, giving report to the trauma surgeon there, getting the helicopter or ambulance headed their way, and anything else I can do to really allow the bedside team to stay at the bedside.
Dr. Susie, this is Dr. Curtis. I'm looking at the chest x-ray and it looks good. I don't see any pneumothorax. Your lab results are still pending. Based on the child's abdominal tenderness and vital signs, do you think we're at the point of maybe giving some blood and even some TXA?
Yeah, I do have a concern, heart rate of 140, blood pressure, very low, and this rigid abdomen. I think that's a great idea. Can you remind me the pediatric dose for the tranexamic acid? And would you be able to call our blood bank and maybe mobilize some resources? I think you're right, she's probably going to need some blood.
And Clancy, the helicopter just landed at your landing pad. I'll send you all of the nursing documentation I have so far, and I'll also call report to the accepting hospital's ER.
Oh, that would be so helpful. Thank you so much for all your help.
You're welcome. Great job, everyone.